Hello everyone, Chief Meteorologist Christy Henderson here, tracking just a mess on radar still, and we do still have a lingering severe thunderstorm warning in the northwestern part of Spartanburg County. National Weather Service indicating they may extend that warning, but they haven't yet. It officially expires at 9:45. We do still have flash flood warnings in effect for Spartanburg and also Greenville, and this huge area of thunderstorms here in Pickens County is going to work its way closer to the downtown Greenville area, so watch out for that, and very heavy rain and thunderstorm activity as well in Anderson. There's a closer look at the area of thunderstorms that helped to prompt the warning. We've got some winds trying to push ahead of that storm in Rutherford County as well. So lots to track, but so far no additional warnings. We'll keep track of it for you though. Jamarcus?
Thanks so much, Christy, and be sure to download that weather app so you can track that all throughout the day. We appreciate you, Christy. Thank you for your hard work. Okay, joint pain is not always just a part of the aging process. When is it time to get checked for arthritis? National Rheumatoid Arthritis Awareness Day was just a few days ago, bringing awareness to an estimated 54 million Americans living with joint pain. This morning we had Dr. Suhail Kumar here with us to talk about rheumatoid arthritis. Good to see you, Dr. Kumar.
Great to see you, Jamarcus. Thank you.
So this is something that impacts obviously a lot of folks. And arthritis, let's talk about basically what that is, and then is there a treatment that you offer that can help people with dealing with this?
Absolutely. Just as you mentioned, arthritis can affect a lot of people. So joint pain is one symptom of arthritis, and there's a term for that, which we call arthralgia. But if the arthralgia becomes more progressive, including joint swelling, particularly joint stiffness, warmth or redness on the joint, then we term that arthritis because it's truly due to inflammation.
And a lot of people use those terms interchangeably, but you're saying one is a symptom of the other.
Certainly could be, or it could be a precursor to the development of the arthritis.
Awesome. So what types of treatments are available for someone dealing with arthritis? Well,
these days there are so many great treatments. So first key is to determine what type of arthritis one person may be affected with, because there are so many types. And depending on the type of arthritis that is determined, then we determine individually what treatment is best for that person.
So you kind of have to take an inventory of that person to see what their symptoms are, what other things they may be dealing with that are also, aggravating those symptoms. So you kind of have to take that inventory individually.
Absolutely. That's the key with good patient care, is to really do a thorough history, a good physical examination, and then certain diagnostic studies to help determine what type of arthritis one is affected with and then how we can best treat it.
When's a good time to get that treatment? Is there a kind of a point where you're like, I just can't deal with this anymore, or is it something you do as routinely as a physical?
Well, either or, but certainly what my advice is for patients is any one of us can have joint pain for maybe something very small, but if the joint pain becomes persistent, it doesn't go away, or it becomes progressive, or it gets those other signs or symptoms that indicate arthritis is developing, or if it's more than one joint and we're starting to get many joints are involved, those are definitely key signs that one should get evaluated for arthritis to determine if we can help treat the arthritis, calm it down, and prevent it from progressing and affecting quality of life.
Does age matter? Because you hear people kind of throw arthritis on older folks, but is it something that can impact really anyone?
Absolutely. So that's a great question. So we always think of arthritis, and indeed the vast majority of arthritis does affect our elderly population, but there are so many types of arthritis, and even babies and children can have arthritis, if you can imagine that. So if there's a joint, it can get arthritis.
Yeah, and probably I'm sure you deal with a lot of people that are in sports, the young people that may be playing sports, that could be causing some of the issues and injuries and things like that. So
of course, and so trauma-induced joint pain or arthritis can linger on and turn into other types of arthritis as one ages.
So if someone's sitting at home and they're ready to kind of take that step and getting an examination to kind of see where they are, what is the best way for them to get in touch with you, or I may have more additional questions?
Absolutely. So they can always talk to their primary care physician, and you could get a referral to our practice, or they can just look us up online. We're at PiedmontArthritis.com, and give us a call, and we'll be very happy to set them up with an appointment for an initial evaluation and hope we can help them out.
Dr. Kumar, great information. Thank you so much for dropping by, and we'll put more information at our website, yourcarolina.tv. It'll also be on the Living Upstate website, livingupstatesc.com. Thank you so much for dropping by. Be safe out there today.
Absolutely. Thank you, Jamarcus.
Thank you. We'll take a short break. More Your Carolina coming up next.